So as mentioned, the diaphragm is a muscle that lives right under your lung field. Typically in resting position sits like a dome, and then as we inhale, it'll kind of spread out like a trampoline. Your diaphragm has multiple attachments to other anatomy in your body, including your sternum, which is in the front, and then your lower ribs, and actually the vertebrae of your low back. On the posterior side or the back side of the diaphragm, you also have your quadratus lumborum muscle, or your QL, some people will call it, and your psoas muscle as well. So some back muscles that a lot of people will experience tightness with. So when we get into the nitty-gritty of the diaphragm, as we talked about, it's the primary muscle when we practice inhalation. If you ever watch a baby breathe or an infant breathe, they're really good at what we call diaphragmatic breathing. What that means is that we get full expansion of the core and then relaxation as they exhale. The theory is that over time, we are often sat in a chair from a young age for multiple hours a day. And if I have something underneath me supporting me, it doesn't necessarily require me to continue to coordinate my deep core musculature, my diaphragm, this intra-abdominal pressure as much as I would if I were not sitting as much. So what I see a lot of times when people come into my practice is that we will just look at their breath and see how things are working, and I'll find that they're not able to access this space as much. A lot of that is also theorized in the practice of always sucking it in and trying to look skinny, but in reality, that's not beneficial to your core to constantly hold tension here and try and shrink this, right? If we get a nice full breath, we should be able to feel and see this really beautiful expansion and create that intra-abdominal pressure that will support the spine, which lives in this space. So the way I describe it to my patients is, if we're in a flare-up, in general, we should be practicing proper breath, but it's easy to think about when we're in pain, right? So if we're in a flare-up and my spine is moving and I have inflammation and things are really upset, any subtle movements are going to be really uncomfortable for me, right? We need more stability here. One of the best ways that we can begin that practice is by working on breath. So by creating that intra-abdominal pressure, we're going to get a lot of pressure coming into the spine, and it allows that spine to be more stable and get less motion. And in addition to creating more comfort when we're in a painful state, it's also going to allow us to be a lot stronger, be a lot more coordinated, more efficient on our movements, give us more power in things like various types of exercise, lifting, so on and so forth.